You guys, I caught my brother before he goes to the gym. He's gonna be our exercise model for today. Let him know, hit him up. If you need any tax help, he's your CPA. I will link his Instagram here. What's up, you guys? Welcome back to the channel. Ooh, thank you so much for being here. This is Be Well with Dr. D. My name is Donna. I have my doctorate in physical therapy. I have my master's in theology, and I have my bachelor's in health sciences. So I'm all about all things health and wellness. If you haven't been here before, we talk about a lot of things covering wellness, all ranges of topics. But as you can tell by the title of this video is going to be about back pain. And before I jump in, I want to say, if you have not already, please don't forget to click the subscribe button, like this video, share it with someone who might need it. But yes, okay, let's just dive right in. We're gonna talk all things about back pain, but also disclaimer, I'm not your doctor, I'm not your physical therapist, I'm not your healthcare provider. So please, please, please see your healthcare provider for more information and for any specific questions regarding your back pain and issues, especially anything regarding back pain with bowel and bladder issues, or back pain accompanied with a fever, back pain accompanied with a back injury. So please, anything serious and grave and anything at all, please consult your healthcare provider. So just also really quick anatomy lesson. Your back consists of right underneath your neck, going to underneath like your low back, like your buttock area. So there's a cervical region, the thoracic region, the lumbar region, and the sacral region. So back pain. It can be classified in a few different types of categories, I guess you can say. There's acute back pain, which is like a sudden onset. It just happened and it's only gonna last a few days to a few weeks. So that's acute back pain. And then chronic back pain is a bit more long-term, more involved, lasting longer than 12 weeks of back pain. And then acute on chronic back pain is when there's an acute episode. So maybe an injury or an incident that happens, but you've had back pain for a long period of time. Some common and general causes of back pain include muscle spasming, so just tightening up and kind of getting a little aggravated and irritated. So a bulging disc, when there's a disc in between your vertebrae, your two bones, the little disc that pops out and it hits the nerve. So that is going to give you back pain as well as potential tingling and numbness in your legs. There are sprains and strains, and there's fractures, and there's scoliosis, just to name a few causes of back pain. You might also consider family and medical history to look into the causes and the onset of why it happened. Like, is it genetic? Is it something that runs in the family? Is it a 0 or 1 out of 10 pain? Or on a scale of 0 to 10, is it 10 out of 10 pain? What is causing the severity in order to figure out what's going on and how to treat it? If you do go to an orthopedic doctor or a physical therapist, they will ask you these questions about family history, about medical history. They will also probably do a medical exam to kind of check your muscles and your tendons and your ligaments and your bones and whatnot to see what's going on. You may also be referred to imaging, so you might need x-ray, you might need an MRI to get a better idea of what's going on. And then some general treatments that you might be recommended with back pain would be pain relievers, muscle relaxants, using a TENS unit or an E-stim unit, using massage techniques, or using an ice pack or a hot pack to help alleviate some of the pain. So with that said, with that background, let's just jump into some lifestyle adjustments or just some better habits that can help prevent you from having back pain in the first place. And then I'll jump into 5 exercises that can strengthen your back, make sure it's very steady and sturdy, and hopefully prevent you from having back pain in the future. So some lifestyle adjustments. All right, you might have heard these before, but move your body. What I mean by that is every hour or two, get up and move around, or put an alarm on, put a timer on. This is something that I would always recommend to patients. Put an alarm on, put a timer on your phone every hour, hour and a half, or whatnot, to make sure you just get up, move your body, stretch around a little bit, just to get the blood flow going and to not stiffen up your body. Another lifestyle adjustment is just sitting with proper posture. So make sure that you're sitting upright, that your hips are at 90 degrees, your knees are at 90 degrees, and your ankles are at 90 degrees. You're not crossing your legs regularly, you're not leaning to one side, you're not doing this all the time. Staying upright, and your back, your low back, can be supported with a pillow. Not only sitting posture, but standing posture. Maybe you've noticed, or maybe you can be more aware that when you are standing, maybe you lean towards one hip, or maybe you lean against the wall, or maybe you're leaning back towards something typically. Try not to sort of cross one leg over the other when you're standing. Another lifestyle adjustment hack or tip is to watch your lifting posture. So what is that? When you lift up a box or when you lift up something from the floor, some tips and tricks would involve to bring it as close to your body as possible. Bend with your knees and not your back. You hear that all the time, probably. Don't bend with your back, don't hunch your back over. Basically go into a squat position in order to lift that item up. Keep it close to your body and squeeze your butt cheeks, squeeze your legs, and use your legs to propel you up and not your back. Another lifestyle tip is to get comfortable shoes. If your shoes are too tight, if they're too narrow, if they're too small, if they're not supportive enough to your arch or too supportive for your arch, that can also be causing issues up the chain. And what I mean by that is that your whole body is a chain. And so things that happen at your feet will affect your hips. Things that happen at your knees will affect your hips and your back. Things that happen at your shoulders will affect your hips and your back. So it's all really connected. And the last lifestyle tip or hack before we jump into the exercises is to sleep on your side with a pillow in between your legs. What this does is that when you are on your side, your knees are not caving in and your hips are not falling at a high angle. So basically when the pillow is in between your knees, it lifts up your knees to meet the level of your hips, preventing your hips and your back from hurting or stiffening later on. So let's jump into the exercises. These exercises are just really good for keeping your spine fluid and flexible and healthy and strong. For these exercises, I will definitely go ahead and explain them as thoroughly as I can, and I will have a demonstration of them. So to prelude, these exercises are not exercises that consist of doing 1,000 sit-ups in order to get a 6-pack or an 8-pack in order to have a strong core. Even if you do see the 6-pack or the 8-pack or a strong core, that doesn't mean that someone's back is strong just because they have a 6-pack. So how I like to explain it is that if this is your back, so these are your vertebrae, and there's the disc in between each vertebrae, right? So these are your vertebrae, one on top of the other, and then in front of these, there's 3 layers of abdominal muscles. So there are 3 layers of abdominal muscles, and the outer layer, the one that you think of with the 6-pack or 8-pack, that's the one that people see. But the thing is, strengthening that outer layer doesn't necessarily strengthen your back. What we want to do, and what the point of doing these exercises that I'm about to explain, is that you want to strengthen the muscles that are most connected and closest to your back in order to keep the back strong. So we want to attack this from both the stomach, the deep core muscles, and then also the muscles in your back that are attached to those back vertebrae that are going to keep it strong from the back as well. So with that said, the first exercise is the cat-cow. This is not really a crazy hard, super crazy exercise, but it's going to keep your spine fluid and flexible. So for this one, you get on your hands and knees, and what you want to do is you want to arch your back. So get into an arch where your back is curved down. Also, your neck is going to go along with that. And maybe holding here for 5 to 10 seconds and then go the other way. So then you're going to arch it the other way and then your head is going to go down. So same thing. 5 to 10 second hold, just feel the stretch in your back. You can hold it for longer, 15 to 20 seconds if you'd like, and continuing a few repetitions of these in order to open your back up and in order to just increase the flexibility of your back and your vertebrae. The next thing you might want to try is opposite arm, opposite leg. So while you're in this quadruped or while you are on all fours, you want to lift up, let's say, and this is a progression. You can start off a little bit more basic, just one arm at a time, and then just one leg at a time. So this is a bit of a progression of lifting one arm and opposite leg up. So let's say right arm and left leg, and then hold it for about a second or two and then bring it back. And while you're doing this, also side note, you want to try to keep your back level. So you don't want to arch it. You don't want to curve it that way. You want to keep it as level and as steady as you can while using your core muscles to hold your back straight. So again, one arm can come out. Let's say your right arm and your left leg, they're going to come out straight. You're going to hold it for about a second or two and then bring it in and then switch. So then your left arm and your right leg will open up. So another exercise is called supine marches. Supine meaning you're on your back, and marches. So you're going to be lying on your back and your knees are going to be bent. And some information before you start doing this exercise, because it kind of makes sense. You know, you're on your back and you're just marching. Yes, but in order to engage those deep core muscles, those muscles that are most closest and connected to your spine, here are a couple ways that you can go about thinking about and doing it. So first, you can take 2 fingers, find your hip bone. So it's those 2 bones that are kind of coming out in the front of your hips. Go about 2 inches in and 2 inches down. And what you can try to do is imagine that on the bottom, the small of your back, there's a little grape. Posteriorly pelvic tilt. So tilt your hips a little bit back and you're squeezing your back against the floor and you're squashing that grape. So when you activate those muscles and when you squeeze that grape, you should feel the muscles underneath your fingers, your deep ab muscles activated. And you want to keep those activated as you're doing your marches. So your deep core muscles are activated, your hips are a little bit tilted back in order to squeeze that grape. And you're going to lift one knee up to your chest, bring it down, lift the other knee, bring it down, lift the other knee. And meanwhile, you're breathing. You're not holding your breath for this. So see if you can do about 10 of those, take a break, and then see if you can do another 10 of those. These sound easy, but they're actually pretty hard. The next exercise is while you're on your back, it's going to be bridges. These are a bit of a classic exercise. Everyone kind of knows for the most part what bridges are. You're on your back, your hands are on your side, and what you want to do, squeeze your butt cheeks, and you want to squeeze, again, that grape, and you want to squeeze your tummy tight. but lifting up this time. So you're using your butt cheeks to squeeze you up and to propel you up so that your back comes up and it's almost a straight line being made between your shoulders and your knees. You can hold for a second while you reach the top and then bring it back. So you should feel, this is almost like a full body exercise. You should feel your core, your shoulders working, your legs working, your butt cheek muscles, your thighs working. And then whether you want to just start with a few of those or work up to 10 or 15 or 20 of those, that can really help strengthen your whole chain. And then the last one, you'll have to stand up for this one, but the last one is a squat. So again, one that you might have probably heard of, but this does not have to be holding a heavy barbell, squat as deep to the ground as you can. This is not that. So this can literally be as easy as you stand in front of a wall, you're maybe a foot in front of a wall, your feet are shoulder width apart, and what you want to do is pretend like you're about to sit down and have your buttocks or glutes tap the wall and come back. So it's a very small movement. You're activating your core again, and you're squeezing your glutes, you're squeezing those butt cheeks as you pretend like you're sitting down and you're leaning back. The other thing is you don't want your knees to go past your toes when you're doing this. All right, you guys, that was 5 exercises. I hope that was helpful. You might have known them already, but hopefully that was helpful. Hopefully that gave you some insight into back pain or how to adjust some lifestyle modifications in order to prevent issues from happening. Let me know in the comments below what you thought. Let me know if you've tried any of these. Let me know if these have been helpful. Let me know if anything else has been helpful for you. As always, don't forget to comment, to subscribe, to like, to share this video. It really helps this video and this channel. Thank you guys again so much for watching. I'm really thankful for you being here. As always, be well and have joy, and I will see you guys in the next video. Bye-bye.